on the dressing? You guys want me to put the pump on? How does everybody understand the pump?
Do the pump too.
Okay. Okay, I certainly will. I want to make sure my batteries. All right. So my name is Morgan with Fitzsimmons. I've been a wound vac educator for 5 years now. There are some ways that you can cause some harm to a patient. Number one, the biggest one I'm going to tell you is if it is a pressure ulcer that you're applying a wound vac to, you must always bridge the port pad, okay? And the port pad is this. So the port pad, when you put your foam in, cannot be down on top of the wound bed itself because negative pressure, it's sucking that, right? But it's also causing more pressure. It has the possibility of turning the wound bed black from the force of that. I have seen it happen, okay? So if you get an admission and you have a patient that has a wound vac order, but you're not really sure if it's a pressure ulcer or not, just to be on the safe side, always bridge it. And then you don't have to worry about it, okay? Until you find out what it is. So I will show you guys the bridging technique, and that's how I'm gonna show you, okay? That's one of the main reasons. One of the other reasons is when you're not window framing the wound edges, okay? Does everybody window frame, know how to window frame, have any idea what I'm talking about? Okay. So for starters, if you YouTube this, and that's what a lot of nurses will do because they're, you know, in the middle of the night or whatever. If you YouTube it, there'll be some videos that will show that they don't window frame and some that they do. Always window frame. It protects the skin. Also, it helps when you put your top layer of drape down over the foam. You've got drape down on the window frame here. As you can see, I can't get off of this dummy. It sticks to that better, so then you get a better seal. So if anything, absolutely to help yourself get better seal, but definitely to protect the patient's skin, okay? So the first thing I do when I open up my drape is I cut it in half. No matter what's in the crease, no matter what size my wound is, I always start with strips to do my window framing. It's just easier than trying to cut a big piece and cut the whole, okay? Because you'll get two, say we're gonna cut this hole the old fashioned way and put this down. Then you've got all this drape that's gonna go down into that cleft or any like skin folds, and that's where you're gonna lose your seal. You've got too much drape. So you don't wanna use too much drape, you just wanna use enough. I cut it in about 1-inch strips. I cut probably 4 or 5. You can always cut more if you need them. We're gonna cut 5 since I'm gonna do it with the Spiro and I'll need an extra one for securement. Okay, so very first off, you wanna look at your physician's order. It's gonna tell you what to clean the wound with, pat dry, and then always make sure you have skin prep in your order. Take skin prep and wipe around the edges of the wound, okay? That will help that drape seal down better. Skin prep is the answer to a lot of your prayers with keeping them sealed, okay? So after you've done that, you're gonna look at your strips. And they have numbers 1, 2, 3. I can count, but for some reason I don't look at that because it just confuses me more because they're upside down and here and there. So in the middle of the strips that you cut, you'll have these 2 little pieces here that you can open. Okay. Put them down completely to the wound edges. Okay. This piece, the ruler is the last piece you take off, okay? Because if you take it off first, you're not gonna be able to take this top piece. So there's a top layer here you take off first, then the ruler, okay? So here's where it's really, really important. You want that drape to go clear up to that wound edge because it's gonna protect it in case you have any foam that hangs over, okay? It's gonna be hanging over onto that drape. Of course, you want as little foam as possible doing that. See how this is, and I'm over. I would rather you go into the wound a little bit. That's fine. You can just push it down. It's going to protect that edge. Then not get it close enough, Okay, it's a must. You must get it close enough. You can trim your drape. I'm picky, I trim mine because I do 20 or 30 of these a week. Okay. If you're going to trim it, make sure you trim it on the end that's not the ruler because you won't be able to get it apart. So then we're going to go ahead. Frame that part. The drape is the hardest part, cutting it and messing with it with gloves on, okay? The rest of it's pretty simple. Now, the biggest mistake that nurses make with the drape is they try to stretch it and pull it because they're afraid it's got crinkles in it. They want it to be perfect, so they'll stretch and pull, and then that causes you to not get a good seal. It is okay if there's crinkles in it. It doesn't have to look perfect. It will still work the same. You can bend this a little bit this way and that, and this is fine, but if you start stretching a lot, then you're not gonna get a good seal. It doesn't have to be perfectly to work the way it's supposed to, okay? So now, we've got our window frame on. If I were you, I would do my next step, and this is what I do because this helps with sealing. I would open up another piece of Skin Prep and I would wipe all over top of that window frame. You know how Skin Prep is really, really sticky? It just helps that seal and takes care of those micro leaks in the end. So I would wipe that. So now, we know we're gonna bridge, we know this is a pressure ulcer, so we're gonna bridge it, right? So I go ahead and I cut my bridge drape next. So you wanna make sure your bridge drape is connected to that window frame because that foam is going to be, all that drainage is gonna suck out of that foam across all that. So you wanna make sure that this is down so it's not running all that exudate and drainage across good skin, okay? So now we have our window frame and we have where we're gonna place our port pad. We have our bridge drape down, okay? Technically, if you have an ulcer on this sacral, buttocks, or coccyx, you're not gonna lay the port pad here, okay? We've gotta do this today for our demonstration because that's all I have is a butt to do with. But think about these before you place them on a patient. Even if it's not a pressure ulcer, you wanna think about how this poor patient is going to lay on this. And if they lay on this, it's gonna do the same thing and it'll cause another deep tissue injury like a Foley. So think about it. Would you wanna lay on this hard piece of plastic? So if this was a real patient with a pressure ulcer in the sacral area, you're gonna bring that bridge drape clear around to either the abdomen or down here, because that's where you're ultimately going to lay that port pad, okay? I've went into buildings where a patient had some cancerous lymph nodes taken from their underarms, and they didn't understand why the device wasn't sucking correctly and it was getting clogged. And I went in, and she was probably an 88-pound lady, and it was under her arm, and guess where they had the port pad? Right here. Well, how uncomfortable would that be? Number one, it's gonna get occluded, right? So I just said, you need to bridge it over to the top of the breast or the chest, okay? So think about these things, like the bottom of the foot. I walk in buildings all the time, and people have these on diabetic ulcers on the bottom of their feet, and guess where the port pad is? On the bottom of the foot, and they're walking on it and they're wondering why it's occluding and not working, okay? So you gotta kind of think these things through. So we have that down. Next, I will say this is my favorite, the Spiro. We have 14 different kits, so that does make a difference. If you're not sure what you need to order, call me, okay? And when I say call me, when there's no one else here, on this device, there is a 1-800 number. That'll get you through to customer service. Someone's gonna answer that 24 hours a day. And you say, I need to talk to the wound vac educator. There is always a wound nurse available for you to talk to. They will call me, they will call the others. 24/7, weekends, 2 a.m., Christmas Day, it doesn't matter. So don't struggle, just call the number on here, okay? We will help you. All right. So next, I sometimes just go ahead and cut what I know I'm going to need. Just depends. When you've been used to the patient and you've been doing it a while, you can cut your stuff, you know, outside of the room or whatever, get ready. All right, so next, the Spiro is what I use for all buttocks, sacral, and coccyx wounds, because 9 times out of 10, you're talking about a pressure ulcer, correct? Okay, so you know you're gonna bridge it. These are the best for that because you can use this for your wound bed. You can also use it as a bridge. And it's also great because you get 2 in a pack. This is technically a thin foam. You can build your bulk. Great for undermining, okay? Don't have all that cutting and trying to make it shaped the way it needs to be shaped. You just stuff it in your wound bed. Right, like that. So, and another reason I cut an extra one is because it pops out of this when I do it on my own. There it is. So I use this piece here just for securement real quick to hold it down. Okay, and I'm going to show you something. You want to try to get all your foam into the wound bed that you possibly can. Okay. But see here, maybe this is like over the edge just a little bit out of the wound, but it's on that drape, so it's going to be okay. But, you know, when I do put the device on and it sucks down, it'll probably pull that down in and you won't notice that. So that way, if you have your drape there, you don't have to worry about it being perfectly cut to fit, okay? You want to do your best to do that. But it protects it from getting reddened. All right, so next, you want to go ahead and cover up your wound bed. I like to cut my drape in several different pieces. You can always add more drape if you don't have enough, as opposed to, like I said, the big pieces, so you don't have it in spots you don't need it. Here's another technique that will help with the seal. When you put your drape down, you want to push the foam down into the wound bed at the same time, okay? That helps with a tighter seal and keeping it sealed. Okay. So right now I just have the wound bed covered, but I've still got my bridge drape. That's fine. We're going to cover that too. Okay. So like I said, we would technically bring this around. I like to coil or make my port pad foam bigger, and I'm going to show you why in a minute. So when you're going to cover this, make sure that your bridge foam is laying on your bridge drape, okay? Not over here where it's going to pull onto the skin and the drainage. It's going to pull over top of this. You want to make sure it stays on there. When you cover your bridge foam, you want to do the exact same thing. You want to push the foam down as you're putting that drape on top of it so it pulls nice and tight, okay? That helps with the seal. Now, I'm kind of anal about this, but it does work. I go ahead and take skin prep again, 3 or 4 pieces. I wipe all over the entire top of the bridge, drape, everything again, because if there's any little leaks, that skin prep's gonna seal it up, okay? Believe me, that is the answer to your prayers to keep them sealed. Now, you're gonna cut a nickel to a 1/4 size hole in the foam where you're gonna put your port pad. You can just pinch up, you can cut the foam, it's no big deal. So there we have our hole. Again, you wanna think about where you're placing this, how this cord's gonna lay, this tubing. You're gonna put it right over top of that hole. Like that. I even, at this point, if I want to, I go ahead and take skin prep and wipe all over top of that piece too. Doesn't matter when you do it. You can wait and put it all down and then turn the device on, and then whether it's working or whether it's sucking or whether it's not, I still do it over the whole thing. So I would wipe it over this too. Okay. Your canisters only need to be changed once every 7 days or when they're alarming full per regulation. They do not need to be changed with every dressing change. Okay? They're very costly, so no need to do that. Nurses like to do this. There's little rubber grippers on these arms. They like to take them off because they think it's packaging, but it's not. We need those rubber pieces on there to make it seal. So male to female end, we all get that right? And on, okay? Now, you twist both ends together. Okay, just like that. Make sure everything is unclamped. We do have a little tag where you can put your initials and the date. All right, so this is the point when you turn it on like a laptop. We all start praying that it's gonna seal, but if it doesn't, that's fine. I'm gonna show you guys how to troubleshoot. It's very easy. Actually, this machine will help you. Turn it on just like a laptop. When you have a long bridge, it takes longer to suck down a lot of times, okay? Well, right now it's showing we got a little leak. It'll start alarming in 3 to 4 minutes. So this is when you wanna listen. You sometimes hear it, sometimes feel it. Get your skin prep out, cut more strips, kind of push down. I hear it. Kind of push down to help it seal, okay? When you get it, I'm gonna let it alarm here in a second. Sometimes it seals by itself, just in a little bit. But here's what I tell nurses, okay? Let's pretend it's alarming. What do we usually do when it's alarming? It's a nuisance because it's aggravating the patient. I used to do the same thing. You run in and shut it off. Don't do that. This is going to help you when it's alarming. So if the STNAs come after you to tell you, hey, this is alarming, walk in, pick up the device. Yeah, it's sealing a little bit, but it's got a leak. Read what it says. It's either going to say check canister, which could be the canister. If it's not the canister, it'll tell you or loss of suction, okay? Don't shut it off. Continue to use your skin prep. Reinforce, okay? Now, here's another thing. I have nurses call me all the time. It's sucked down, but it's alarming. Everything seems to be okay. And they think it's the device. It's not usually the device. Once in a great while, it is the device. But here's a way to check that. If you clamp one of your clamps and it silences the alarm, it's your dressing. Always. Okay? So this isn't my dressing. It's my demo, which it needs some work because I've had it for a while and I have to send it back in for maintenance because we don't use this on patients. All right, so that is how you know if it's that. If it quiets, then it's your dressing. Yeah, it's due for PM. Now, any questions about that? I'll silence it real quick. Any questions with this? So we get frustrated, and we don't know why it's alarming. Just always remember, even though you think you've done it correctly, clamp this. If it stops alarming, then it is, there's a leak in your dressing, okay? Any questions about that? All right, so I want to show you this. When you're bridging, okay? If you bridge around to the fat, the adipose tissue, I should say, on the stomach, it's okay if this little port pad hangs over. What I mean by port pad is this little plastic disc, okay? Now, if you're gonna bring this around to an elderly person's hip, we know that's bony, right? and there's a lot of bony. And a lot of times if you have a wound on a foot and you want to bridge it to the top of the foot, there's no flesh there, right? It's bone. You want to make sure that you have plenty of foam underneath of this port pad. Okay? This port pad will cause another deep tissue injury if you don't have foam under it. Even though there's drape under there. Do you see what I'm saying? That foam protects that bony area. So that foam is not there, then this plastic piece is going down into the skin as it's pressuring. You will have a deep tissue injury the same shape as this disc. And it'll be obvious that's what happened. Okay? So that's why I do it all the time like this. Even if you have a square piece like this and you're not using the Spiro, you're using this for your bridge, I just make sure I cut that bridge big enough right there for that whole pad is underneath that disc. Does that make sense to you guys? It will cause a deep tissue injury. It won't on adipose tissue, but it will if it's near a bony prominence. Foot, somewhere bony, like up here, there's no fat. Yeah, you want to make sure there's plenty of foam under that bridge. Now, if you have a patient who's having a lot of pain when you remove this, because sometimes women do, especially the abdomen, not necessarily with pressure injuries because the tissue is damaged deep, so they don't have a lot of pain. If there's anything good about pressure ulcers is a lot of times the tissue is so dead they don't feel a lot of it. So when you go to clean it,
Quick question.
yes, interrupt me with anything.
How many seals do you have to use?
That's too much.
How many what?
The one thing that you use to seal the whole thing.
The drape.
The drape.
As many as you need to cut. You can cut as many. You weren't here when I was cutting the strips for you. So-
I saw you just put 2 of them.
I
Just
will-
one on there.
I will send the video that shows everything and work ready so that everybody has it too, okay?
So you want to make sure that you window frame the whole entire wound edges, okay, for protection. All right. So when you go to clean this, you can like pour your normal saline down in there, or if you have the IV normal saline, if they're having a lot of pain with removal, you can cut this, shoot that down into there, leave it set a few minutes, and then take it out. It'll help. If there's a lot of pain with it anyway, you can also call the doctor and ask them for an order of lidocaine. Obviously, it takes a physician's order. You can shoot that down into there, leave it set. Like I said, you usually don't have a lot of pain with removal, and unless it's women with their abdomen. It's just one of those that I get a lot of calls about. Okay, and then you can take it out easier. Now this drape sticks to this dummy a lot more than it does human. Obviously, that's why I need a new one, and it's doing that. So, any questions?
How do you make sure? Because we had a patient with a wound on the middle of the bottoms.
Right here?
Yeah.
Right,
spot?
like this,
And you
Yep.
have
like this.
to seal the whole.
Okay. You may have missed that too. Make sure when you're cutting your drape that you're trying to stay away from those skin crevices, that cleft. Like if you're putting this on a foot, try to stay away from theirs. So you learn to cut your drape shorter. Instead of using one big piece, start with smaller pieces and connect them if you want. Does that make sense?
With hers, the problem we're having with that.
Like instead of a great big piece like that.
Her wound is just right here.
Yeah.
So how do we avoid this side?
Yeah, because there's always a space.
Okay.
Now we seal.
You've got to, again, it kind of takes a little bit of time. You have to cut your drape as thin as you can there. And then we also have a little skin prep paste that we sell also. And you can also use your Bravo strip. Like this is kind of like Ostomy paste, but better. If you have that, just squeeze that dot like right there where that cleft is and right there, and then you can lay that drape on top of this.
Oh, okay.
Okay? Does that make sense? Okay. Now there
So what about, excuse me, what about if you don't have this? How do you do it?
you can use ostomy paste. You can do
And if
that.
you don't have the paste, because what those time doing, we didn't have no
She
ostomy paste for
left
it.
ostomy paste, but when I went, it was gone. I don't know why.
Okay,
You can
and let
also
us
use-
know and we'll order more.
You can
Let
also
us know
use
when it's
this.
getting close and we'll order more.
You can also use this,
What is that one?
like Coloplast, the bridging. You can use that. Or just cut very, very, very small there.
Small.
Yeah.
Yep.
Yep. Okay. There is one other way that you can hurt a patient. And I didn't go over that because we were doing the other first and technically working on that whole wound frame. If you have in your wound bed, if you have a structure exposed, and what I mean by structure, bone, tendon, muscle, ligament, you must put down a contact layer first before you put the foam in. Because if you have that structure visible, what does this do? What does this whole device do? Sucks everything dry, right? It will ruin that tendon. You can't get it back. It will ruin the bone and kind of make it like little holes, okay? So yes, you want a contact layer. And what I mean by contact layer, and I always use the word contact layer because that way if you don't have a certain type of dressing, you can use another one. That is a piece of Adaptic. It can be a piece of Zero Form. It can be emollient dressing, okay? Anything that has that greasy,
Stop.
put it down in that wound bed. It can cover that whole wound bed. It's no big deal. Then put your foam down. That helps keep that structure moist, okay? So if you see that, you definitely need a contact layer, okay? Because this will dry it out. So, 3 things. If it's a pressure ulcer and you don't bridge it, it can cause harm. If there's a structure visible and you don't use that contact layer first, it can cause harm. And if you're not using your window framing method, okay, it can cause damage. Not always, but in my opinion, why not be safe with the patient, number 1. Number 2, actually when you go to cover the whole foam with that other piece of drape, it's gonna seal to that window frame drape better than it would the person's skin. So why not do that to begin with? Okay? Any other questions you might have for me? You guys can ask anything. It does make a difference on what foam you're using. Like I said, we have 14 foam kits. If you call and say, I want a medium foam kit, they're gonna send you the thick, medium thick. If you want the thin, you wanna say medium thin, okay? So we have small, medium, large, and extra large foam kits, thick and thin. Does make a difference. Don't order the regular foam for the top of a hand, a top of a foot, a heel, an arm, a bony prominence where there's no depth to the wound, okay? Because what you're gonna do is you're gonna have a hard time getting it to seal. And technically you're not supposed to cut the foam. You can cut it length and width wise, but depth wise, it's made to do what it is. Now, do nurses do that and we get by a lot of times? Yes, we do, but if it's not working, that might be why. It's made to be that thickness. That's why we have those, okay? I hope that helps.
Okay.
Okay.